Mr. President,
Senator from South Carolina is recognized.
I'd ask unanimous consent to terminate the quorum call.
Without objection.
And I'd like to have a few minutes to talk about the health care repeal.
Without objection.
Thank you. Thank you very much. Mr. President, the country is debating a lot of issues. We've passed the health care bill last year. Now there's an effort in the House to repeal and replace it. I joined my House colleagues with the idea that we should start over and come up with some product that was truly bipartisan, that will lower cost. And all the information we received about this bill since it was passed showing it's going in the wrong direction. In May 2010, CBO Director Doug Elmendorf stated that rising health care costs will put tremendous pressure on the federal budget during the next few decades. In CBO's judgment, the health legislation enacted earlier this year does not substantially diminish that pressure. We're getting more and more input about the effect this bill has on cost because there's over 700 waivers now in terms of the mandates. 40% of all the waivers given are to union health care plans, and union workforce is 7% of the total workforce. So the idea that more and more people are asking for waivers indicates that the cost component of this bill is a real problem for the country. And the whole goal of health care reform is to lower cost, improve quality, and I'm afraid that what we've done with the health care bill is that we've increased cost, consolidated power into the federal government, and Medicare and Medicaid already are unsustainable when it comes to federal financial obligations. And the Obama health care bill, if fully enacted by 2014, would extend Medicaid coverage in the state of South Carolina to 29%. 29% of South Carolinians would be covered by Medicaid. That's a substantial increase over the number of people on Medicaid today. That would require my state to come up with $1 billion more in the next 7 years of state matching money to get the federal government Medicaid dollars. The second largest expense in South Carolina today is the state's matching requirement to get existing Medicaid dollars from the federal government. If you expanded Medicaid, you're going to bankrupt South Carolina, and I think there's a better way to deliver health care to low-income Americans. I was on a bipartisan bill with Senator Wyden and Bennett that did cover everyone, but it allowed people to buy health care in the private sector with tax credits. It took deductions away from employers. That's a lot of money. And it took that pool of money and allowed individuals to buy their own health care in a more competitive environment. So at the end of the day, it looks like we're going to be taking a vote here soon in the Senate, I hope, to repeal and replace the health care law that was passed last year. If it is repealed, it should be replaced. And the way you replace something this complicated that affects 1/5 of the economy is you do it deliberately, you do it in a bipartisan manner, and let's remember how this bill became law. It got exactly 60 votes, a party line vote in the Senate. It was passed on Christmas Eve a couple of years ago, and at the end of the day, the process I thought was not befitting of the United States Senate. There was a lot of provisions given to senators in particular states, like in Florida, Medicare Advantage participants had a lot more Medicare Advantage availability than other states. Ohio, Michigan, some healthcare companies in those states got special deals. At the end of the day, it was done in a back of a room in a partisan fashion, not transparent, not negotiated before C-SPAN as President Obama promised. It really reinforced the worst of politics. And it's no surprise to me that something that came out of that process is not going down well. And what I did today with Senator Brasso, a physician senator from Wyoming, was allow states to opt out if they chose. If this is really such a good deal, let the state legislatures throughout the country decide whether or not they want to be covered by the individual mandate, the employer mandate, or Medicaid expansion. I know the answer in South Carolina. My governor, my legislators want to opt out of expanded Medicaid because it will bankrupt the state. They don't want any part of the employer mandates. So I would challenge the Congress, if repeal and replace doesn't work, let the individual states have a say about whether or not they want to be in this system. I do hope we can repeal it and replace it, and that vote's coming up soon. but the amount of tax increases in this bill, $17 billion in individual penalties, $52 billion in employer penalties, $500 billion taken out of Medicare to help pay for the uninsured. At the end of the day, the formula, the construct of this bill, I think is going to grow the size and scope of the federal government when it comes to health care at a time we need more private sector competition in medicine. It's going to increase taxes on businesses at a time when we should lower their taxes, and it's going to make it very hard in the future for senior citizens to find doctors to take Medicare, because at the end of the day, the more you consolidate power in the federal government, the more obligations the federal government has when it comes to health care, the less we can pay because we're so broke. So I hope that this vote will happen soon. And to my colleagues who want to keep this bill, I respectfully disagree, but that's what debate's all about. We can have a civil debate about the future of health care. I think the Congress would be wise to start over and come up with a new product. And it does put pressure on Republicans, if we do repeal this bill, to replace it with something that makes sense. And what makes sense to me is to lower cost and make sure that people have access to health care and that the uninsured are taken care of, but one size does not fit all. So I look forward to casting my vote to repeal and replace. And if that doesn't work, I look forward to having my amendment, along with Senator Brasso, on the floor of the Senate, allowing states to opt out if they choose. My guess will be that a majority of the states would opt out of the individual mandate, the employer mandate, and Medicaid expansion, and some Democratic governors are going to be talking to the members of this body about how their states will be devastated by Medicaid expansion. I think you're going to have some big states that are in the hands of Democratic governors that are going to feel the impact of this Medicaid expansion. They're going to petition the Congress to do something about it, and I hope we listen to them. So this vote should happen soon. We're in a new Congress. There are new people here with new ideas, and now's the time to allow the American people to participate, because most of this bill was passed in secret without a whole lot of bipartisan give and take. Now's the time to start over. Take the idea of health care reform, blank sheet of paper, and see what we can come up in a bipartisan, incremental fashion. And the only way we can do that is to replace the bill we have before us. So I look forward to this debate. I look forward to the vote. And this issue is not going away. Between now and 2012, we're going to have a very serious debate about the future of health care in America. And I would argue that anybody running for governor between now and 2012 should be asked the question, if you could, would you opt your state out of the provisions I just described, the individual mandate, the employer mandate, and Medicaid expansion? And those are good questions to ask and answer, and maybe they have a good answer why they would say no. But everybody running for the state house throughout the country should have a genuine debate about whether or not their state should be included in Obama health care. And that's why I hope that if we don't repeal and replace the bill with the current amendment that will be offered by Senator McConnell, that we not abandon this debate. Debating policy in a civil way is the essence of democracy. And at the end of the day, I do believe there's a better way to come up with health care reform than that chosen by our Democratic colleagues in the last couple of years. Having said that, the status quo is unacceptable. I am very much for eliminating the pre-existing illness exclusion that denies Americans the ability to buy health care when they get sick. I'm very much for shopping around and buying a plan that is best for you and your family, and if you're a low-income person, helping you make that purchase. But I don't want to consolidate any more power in the federal government when it comes to health care, because the health care obligations of the federal government, Medicare and Medicaid alone, in 20 years are going to cost as much as the entire federal government does today. This is an unsustainable course. Entitlement reform has to be embraced. But until we get to that day, I would like to restart the debate, have a new dialogue with new members of Congress who heard loud and clear in the last election the displeasure the American people have with the process, a bill that was passed in the dead of night on Christmas Eve with a lot of chicanery, replace it with a new process that leads to a better bill, and that puts us all on the hook to try to find middle ground. There was no middle ground found last time. Quite frankly, I don't think a lot of people look for middle ground. Those days are behind us. There's a new Congress. And if this election said anything to us up here in Washington, it ought to be that the country doesn't like what we're doing, Republican or Democrat, and the health care bill, the way it was passed, is the worst of Washington, not the best. And I look for better days, and I know the Senate President tonight has genuinely tried to reform this institution to make it more reflective of the American people's hopes and dreams. The health care bill was passed in a way that none of us, quite frankly, should be proud of. And if we start over, the obligation exists for all of us to find some middle ground to move the debate forward. So the vote will be soon. It will probably be less than 60, but that doesn't mean the debate ends. There are other ways to address this issue. So I can assure the people in South Carolina that this fight will continue, that I will do the best I can as a senator from South Carolina to make sure that the Obama health care bill, President Obama's plan that was passed by the Democratic Congress, is dramatically changed and altered before it takes hold and becomes irreversible. We've got a chance in the next year or so to fix this before it gets out of control. I hope we'll take advantage of it. I look forward to the debate. I look forward to offering solutions. I look forward to more than just saying no, but I do look forward to a genuine debate where I do have a say, and hopefully people on the other side will listen. With that, I yield, and thank you very much for the time.